All right. New video. We're going to focus on limping. This will be focused mostly on dogs, somewhat applies to cats, but we'll talk about what to do, how to think about it when your pet is limping. If you wanted to divide limping or lameness, as we call it, into broad categories as far as the causality of it, you're looking at either orthopedic disease or trauma, neurologic disease or trauma, soft tissue disease or trauma. Those are your three categories. By far, the more common of the three are going to be either orthopedic injury or soft tissue injury. Okay. When you think about the orthopedic category, you're talking about the bones and the joints. Those are specifically what we're aiming at. If you're talking about soft tissue injuries, you're talking about those that are not related to the bones or joints, so ligaments and tendons and muscles. The neurologic component are going to be the neurologic system, mainly spinal cord and nerve roots. And you can put in there also probably neuromuscular junction, which is where the nerves communicate with the muscles. That's the neuromuscular junction. And to determine which of those three categories is afflicting your pet depends on several factors. Depends on the history of your pet, and that's what the veterinarian's job will be, to interview you and figure out what happened, what caused this. Do we know of overt trauma? Is there a pre-existing condition that could have led to this? Was there actual trauma that was witnessed or suspected? Or is this actual disease, which is spontaneous pathology? The second way of figuring this out is based on the physical exam. The veterinarian will examine your pet either with their hands or virtually to try and deduce, based on how your pet is acting overall and with the musculoskeletal system, to determine whether or not we're dealing with an orthopedic, a neurologic, or a soft tissue problem. They'll look at your pet's gait, which is the way they ambulate. They'll look at the conformation of the pet. We're going to look at any signs of swelling, any asymmetry in the legs. We're going to look at where there may be discomfort, the range of motion. There's a variety of factors the veterinarian will assess to determine which of the three categories your pet is afflicted with. Based on that, they're going to determine how severe is this, meaning are we talking about a critical emergency where you have to be seen immediately, for example, like cases of neurologic disease, or is this something that can wait for your veterinarian to see you as an appointment to get testing done and figure things out from there? In which case, what can we do to band-aid the situation until your veterinarian can fit your pet in? The vast majority of these conditions that relate to lameness, limping, and we're not talking about paralysis here, we're talking about limping, are usually not medical emergencies, but it's so hard to tell with pets because they're so good at hiding times where they have maybe significant dysfunction or even significant pain. They'll hide these things from you as a pet owner. So it's always important to go based on what the veterinarian's assessment is, rather than simply blowing it off as, well, we'll just see what happens with my pet and not get the pet assessed. But I want to make sure that everybody that's watching this video have a clear sense as far as how we think about limping or lameness in dogs and cats. The reason why I'm leaving cats as sort of an exception is because they tend to be a little bit trickier than dogs to figure this stuff out. So it's just one of those things that we know just by virtue of the species. But in general, those are your three big categories. Are we dealing with a neurologic problem, an orthopedic problem, or a soft tissue problem? You can have pets that have literally broken bones, we call fractures, or hip or joint dislocations, which we call luxations, and have a pet that doesn't seem to be bothered by it at all, or even is functioning fairly well. And sometimes it takes just the subtle changes, the subtle alterations that only a veterinarian's trained eyes can see in order to make a determination like, hey, I think there's more going on here than just some sort of minor sprain injury. I think this may actually warrant an emergency visit or immediate evaluation. So don't go based on how your pet is actually feeling or what you perceive them to be actually feeling. Make sure the veterinarian can perform their assessment to look for those subtleties that you may not notice as a pet owner. Now, what to do? What do you do in the meantime? Well, there's some fairly safe sort of band-aid mechanisms or actions you can take to try and alleviate your pet's discomfort until your veterinarian can see you. Or if you're performing a virtual visit, like for example the vet triage, then there are things that we could recommend doing, assuming that the veterinarian has deemed this to not be a life-threatening emergency or emergency of any kind, and has deemed that your pet actually is not in significant discomfort or pain. The more common scenarios is most obvious, which is keep your pet quiet until you can see your veterinarian in person to get x-rays and blood work and what have you, to actually institute treatment measures, right? So what do we mean by keeping your pet quiet? No running, no jumping, no stairs, only outside to pee and poop on a leash, so don't let them out on their own, and make sure you monitor them while you're walking them, all that good stuff. And in between their walks, they're just rested, either in a large crate or a large carrier, for example, with small pets like cats and small dogs, or confined to an area of the home that has minimal furniture, maybe a room that doesn't have lots of furniture they can jump on, or keep them behind baby gates to keep them confined. Whatever the case may be, whatever your situation calls for, everybody's got their own different living situations, so it just depends on what you can do. Cats, of course, are trickier, right? Because they climb on stuff, and so you'd have to have a room that is void of any cabinets or dressers or tables or whatever to keep a cat quiet. So ideally in those situations for your cat, you'd have a large dog crate, for example, with enough room to try and say, okay, can I fit the litter box in here? Can I fit food and water in here for my cat? That way we're restricted activity, but we can still be able to eat, drink, and have an area for eliminations. Dogs, because they usually are not potty trained, although some dogs are, and you have to take them outside to go pee and poop, you need to eventually take them out of wherever you're confining them. So, and then of course make sure that wherever your pet is confined, there's good footing. You don't want a slippery floor like linoleum tiles or wood. You like to have carpeting or rugs down, or maybe yoga mats for good traction, so your pet doesn't slip and fall and then perpetuate the problem that we're trying to fix here. All right. That's your first safety advice. The second thing you can do is, in preparation for your impending vet visit, especially if you had a virtual consultation, a teletriage session with vet triage, you want to make sure that your pet is fasted the night before your veterinary appointment. Fasted means no food after midnight the night before and no breakfast the morning of that appointment. Water is fine. Don't withhold water, but no food after midnight the night before, and no food the morning of your appointment. That way, if your veterinarian wants your pet fasted for whatever reason, blood work, for example, sedation for some x-rays, for example, no matter how good your pet may behave, the scenario is very different when they're on an x-ray table at the veterinary office. Sometimes you need sedation to get the proper positioning for the pet, and not every pet is going to deal with that kind of positioning. They could be in discomfort. It just could be awkward positioning. Not every pet can handle that. So they're fasted for those reasons, in order for your vet to perform either sedation if they need to, or blood work to have them fasted, just like your regular doctor. Want them fasted. The third thing is in line with the first advice, which is keep your pets separate from one another. If you have multiple pets at home, or even small children that like to play with your pet, well, we can't have them playing if we're trying to restrict their activity, right? So make sure that we have them separated from other pets and from children. Again, this could be very difficult depending on your living situation, but I'm talking to you about the more ideal scenarios here. So we want to make sure that we have all these advice lined up. Fourth thing is, if you know where the discomfort is on your pet, let's say, for example, we've kind of pinned it down to the hip joint or the ankle or whatever it is, then you can do a cold compress, an ice pack over that area. A couple times a day for about 5-10 minutes, depending on the tolerance of your pet. Not every pet's going to deal well with the compress therapy, especially cats. They tend not to sit around for too long unless they want to. And so you can ice pack the area, make sure the temperature of the ice pack is comfortable to your own skin. And, ideally you would hold it there for maybe, a couple of minutes, but no more than 10 minutes. We know that after 10 minutes, you can actually create tissue damage to the soft tissues and the nerves. So we want to make sure that you maintain the duration less than 10 minutes, but at least for a few minutes, a couple times a day, 2, 3, 4 times a day. And that's only really if you know exactly where the location is. If all you know is that the limping is from the hind leg, to ice pack the entire hind leg is silly. It's just not realistic. It's not really helpful to anybody. So we want to make sure that you know where exactly you're targeting, which is with the help of the veterinarian, of course. And then finally, medications. It kind of depends on what you have at your disposal. It depends on where you're at on the globe, your specific state or province or whatever, their rules and regulations, and how much of an emergency this is, as far as whether or not you can actually get medications outside of your normal veterinary clinic's hours of operation. Maybe you have medications at home that you can utilize from either previous pets or for the current pet, or maybe even your own medications that we can potentially use that it's also deemed safe for the pet. I can't stress this enough, do not utilize medications unless under the direction of a veterinarian. There are plenty of medications that are considered over-the-counter that you have full access to, that you may even find advice online that it might be safe to give. Do not give them. Do not give them unless you're speaking to a veterinarian, and to a veterinarian who can actually see your pet and ask you all the historical questions about your pet to make sure that an over-the-counter product or that a product that you currently have in your possession is safe for that pet. I cannot stress that enough. Do not go based on random people's online advice as far as what may be safe to use for over-the-counter products or products that you may have at home. Don't do it. It's not worth the risk. Talk to a veterinarian, either in person or virtually, so they can get the full story as far as what's going on with your pet currently, what their history is like, what products you have at your disposal, and whether or not they are safe and efficacious to be utilized. So cannot stress that enough. There's lots of people out there with good intentions, but unfortunately, they don't know what they're talking about in these situations. You don't know who you're talking to, what their credibility is, what their credentials are, what their experiences are. Make sure you talk to a veterinarian first. So I hope this video is informative for you. We characterize the 3 broad categories of lameness in dogs and cats, as well as some ways we think about it as veterinarians, some safe measures you can take while you're awaiting a veterinary consultation, and then of course the do not do's of medicating your pet. Just because there's information out there on the World Wide Web, we want to make sure that you are directed by a professional who knows what they're talking about. Thank you so much. Leave any questions or comments below. Share the video, share the channel, subscribe, boom, 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 and we'll see you in the next one. Everybody take care. Bye-bye.